Hey guys, this is Dr. Mahajan from Mahajan Medical Center. We got another edition of our webcast today, and we got great guest, Dr. Bob Arnold. He's a local renowned psychologist, and we are very fortunate to have him come and discuss mental health issues related with COVID 19 in terms of enhanced anxiety and depression. So, we're going to be talking to him in a bit. And for you who are tuning in and don't know me, I'm Dr. Ranjan Mahajan. I'm a board certified internist in Largo, Florida. And we've been doing primary care for 25 years. And I've been doing this webcast, and we do it on every Thursday at 4:30 p.m. And we try to bring local thought leaders in different expertise to share with our community for education purposes. Again, I want to reiterate, this talk we're having with you does not replace doctor-patient relationship you have with your existing physicians, or with your psychologist or psychiatrist. This is just for education purposes only. All right, so let's get Dr. Bob Arnold on our podcast, and here we go.
Thank you.
Bob,
Great for having me.
can you hear me well?
I can hear you just fine.
Okay, great. Tell us about yourself a little bit. How long you've been in Florida, where you grew up.
Well, I've been in Florida since 1973. Originally came from New York City, came down here to the warmth. I've been in practice in Pinellas County for close to 30 years now. I'm a private practice psychologist doing counseling, therapy, and assessment. I have offices in Largo and in Palm Harbor. In addition to that, I'm also have associate professor at the National University of Health Sciences and Barry University. So I stay quite busy. Prior to re-entering private practice about 10 years ago, I had spent 20 years working at our local hospice, Suncoast Hospice, for those of you in Pinellas County, and I had an absolutely amazing time working there, but then went to do new things. So.
No. We share some patients in common. They all like you, and we know your lovely wife. She's also in similar field. So if you do something wrong, she corrects you. She's the boss behind the operations.
Undoubtedly.
All right. So, you have your own private practice, and we'll put a link for that. Any of our listeners and people who watch us, if they need any counseling or need Michelle's help. She's a school psychologist, so that's another asset you have. Not only you do independent, also school related IQ testing and things like that. So
Yes.
That's a good resource for the community to have both of you in the community doing excellent work. So tell us what got you interested in psychology.
Actually, it was, quite a long story, if you will. But
Okay.
I was fortunate at a very young age to have a very, very lucrative career as a business person. I was a retailer. And the time came to sell the business, and I was finishing up my MBA, and I thought I would go into industrial organizational psychology. But I happened to take a class. I think the course title was Applied Psychology, and began to learn a little bit more about the field. And by the time that undergraduate class actually finished, I knew that I actually wanted to help kids and families. It just sort of shifted things for me in a very, very, very specific way. And so I kind of pivoted, and I retracted my applications to the industrial organizational psychology programs and started hoping that clinical psychology programs would take me. And I was very, very fortunate that I was able to be educated here in the state of Florida, and then it all was uphill from there. So.
That's a great story. So you are a business person to begin with, so it makes a lot of sense for you to jump from academic to running your own practice.
Yeah.
Yeah, you can use those skills. Let's talk about COVID-19 and what you're seeing in the community. If you look at CDC side, they talk about effect of COVID-19 and changes in sleep or eating pattern. Let's start with that. Do you see that in your practice as well?
Well, since COVID has come upon us, I've not only seen it in my practice, but again, I stay pretty tight in the community, finding out what's happening at local hospitals with healthcare providers, and of course, being in touch with teachers, other educators, administrators. First and foremost, COVID, particularly early on, took everybody off their schedule. And part of that also had to do with eating and sleeping. A lot of people were stuck at home. They weren't keeping their traditional routines. And usually, when people are stressed out, they either don't eat or they eat too much. These are things which align with depressive symptomology and anxiety, and reminding ourselves that the symptomology itself doesn't always lead to a clinical diagnosis, but everyone's been taken off their game. Their habits, their routines, the behaviors, the things that they would typically do, or we would hope they would typically do to stay healthy and well, began to sort of go out the window. People would sleep in. Sometimes, they wouldn't get up every morning, get showered, get dressed, as though they were going to enter their regular day, even if they were still working, but working from home. And that's one of the big tips that I think everybody is pretty on board with. That although we've been under quarantine and our routines have necessarily changed because of health and safety reasons, keeping a schedule is paramount. And part of that is being mindful of our nutrition and keeping a good sleep schedule. So, some people have actually improved their sleep schedules because of COVID. But we are a society which does not get enough rest. I think that is a very major public health issue. And so when I'm talking to my patients, one of the first things I always do is a sleep assessment. Are you going to bed at the right time? Are you in a comfortable bed? All the sleep hygiene types of protocols that we need to go through. Are you sleeping through the night? And if not, how can we make that happen? Very often it will require a referral, perhaps back to their primary, if the basic sleep issues can't be handled with over-the-counter types of things like melatonin. You really need to talk to a prescriber about maybe going up the ladder, even if it's for a short period of time. And of course, nutrition.
Yeah, that's a great point about sleep. I think sleep is paramount. I see in my internal medicine practice as well, Bob, that if they don't sleep well, then next day, everything is not right. Not just the mind, but the body is not right either. So more risk of heart attacks, more risk of stroke, and if it persists, more risk of cognitive impairment. So yeah, sleep is critical. And you add sleep apnea to it, that's again a hidden piece a lot of people don't want to accept, and they know that they have to wear BiPAP and CPAP, but it has been associated, treated sleep apnea, as has ramification for mental health, physical health, more pulmonary hypertension, more strokes, more heart attacks. So sleep is critical. Yes. Also, I want to bring another point, and I've seen in my practice, I'm pretty sure that's your practice to begin with, the worsening of mental health conditions. What's your take? Are you seeing people who have pre-existing mental health issues? Are they getting worse?
Interestingly enough, there seems to be three sort of pathways. One is there are people who have sort of tried to self-manage their mental health issues. And because of the potential isolation of quarantine and the changing of daily habits, their mental health issues have exacerbated. Talking about depression, the World Health Organization has been staying on top of this for a while, and it is pretty much the most common diagnosis worldwide. It's moved along much quicker as a result of this. So some people were managing on their own, and it's gotten a little bit worse. Some people who are currently in treatment, actually, because they're in treatment, they're able to be, encouraged and managed. so they don't get worse. And in fact, sometimes the time they've had off has actually improved them. And then there's that wide swath of folks who suffer in silence. They've been trying to deal with depression and anxiety all along, sometimes in ways which are not healthy coping strategies, using alcohol, using drugs, using food, and other types of things to try to soothe themselves. And their fears and anxieties, along with a sense of hopelessness, has increased dramatically. The good news is, for those people who seek treatment, close to 80% of folks find real results within about a 6 to 8 week period. But a lot of people don't seek treatment. They suffer in silence. They try to manage it on their own. And of course, that can lead to a whole host of issues, both psychological and physical. So,
and the next point, and you created a good segue right there, is the increased use of substance, like you mentioned, alcohol and other substances and tobacco. And, as I see in my practice, and you just mentioned, you see in your practice as well, people are self-diagnosing and self-treating with marijuana, tobacco or other substances. And it may give them temporary relief, but long-term, it causes financial acrimony, relationship acrimony, and the mental health issues don't go away; they get worse.
they do.
Do you have anything else to add on this situation?
Well, this is something which is a bit interesting. So, and this is just sort of an artifact. So, people dealing with anxiety and depression, a vast majority of them, that's not where that's not where the help begins. When they do lean into substance abuse or actually, addictions in some cases, that's where people really can see that there's something wrong going on. And we find that a lot of people who are presenting with substance abuse disorders or other types of addictions, if you will, that those are really secondary to other types of issues in their life. They were trying to soothe their pain, whether it was emotional or even people with, primary physical pain and secondary psychological issues related to that. And so they'll present needing assistance with substance use disorders. But when we dig into it, we get a sense that for a while they've been attempting to cope with pain in their life, depression, anxiety, the list goes long. So sometimes when people lean into that a little bit too much, they do go for help. When people are eating themselves into their comfort and they begin to develop type 2 diabetes and they come to their primary and the primary says, listen, we got to get a handle on this. But then we have to ask the second question, what compels you to eat so much? And so all of these things sort of work together. And we have to attack all of them in order to make sure that, again, people can get as healthy and well as possible. So.
Yes. And, the other thing I notice, and you can chime in if you notice anything different, everyone responds to stress differently. And some people, unfortunately, because of their life situation or support or lack of support, they get into anxiety and depression more. And, especially certain fields like food industry, they've been overwhelmed, and healthcare industry, they've been frontline with COVID-19.
Yeah.
People who are homeless, people who already have, we talked about mental health issues, people who are teenagers and children. I don't see them, you see them, so you probably can talk a little bit more about that. They have difficulty because they're not in school, they're not have the structure, and they are more isolated, not have as much dates or interaction with peers and physical activity. I think all that made some of the groups more vulnerable than other groups. What you're seeing in the community?
Oh, undoubtedly, and there are so many layers to this. I mean, this is a very unique time. Undoubtedly, we've not encountered something like this in our lifetime. When you take a look at some of those communities that you've mentioned, so healthcare providers, I see many people who are in healthcare, and everybody's trying to do the best that they can. Early on, there wasn't enough PPE. People were afraid of not only getting COVID, but transmitting it to people who are fragile in their own lives. Most recently, educators having to go back to schools, not really feeling very confident that they're going to be healthy and safe, taking a risk, but without really having much choice. And when we talk about depression, it's more than sadness, right? The hallmarks of depression are really feelings of hopelessness, helplessness, and being stuck. That's really when we've moved into that. Everybody gets sad. Everybody's disappointed. Everybody has a bad day. That doesn't really rise to the level of that type of diagnosis. And when we look at anxieties, anxieties are really based in fear, and fear of the unknown, fear of not knowing what's around the corner, fear of not knowing if you're going to have a job, be able to keep a job, get sick, get somebody in your family sick. Just so many layers attached to this. And one thing that we really haven't talked about yet, at least as a nation, we're going to have, I think probably by the end of this week, over 200,000 people who have died of COVID. And we haven't really talked at all about grieving. This is the largest mass casualty event this nation has ever seen. We've had, far less people die in war than they're dying of COVID. Far less people died in the 9/11 attacks, but we had an opportunity to reflect upon them, process them, and find a way to grieve it. This is something that we haven't even gotten to because we don't know when we're going to get to the end of this. And there are thousands, hundreds of thousands of people. For any one person who died of COVID, we can make the assumption that there are 4 or 5, maybe 6 people who are really hurting desperately because of it. And not being able to say goodbye adds another layer. We've had moratoriums, and rightfully so, across the nation, where people who were frail, elderly, and long-term chronic care have been isolated in their care facilities, not being able to have visits from family and friends. So, these are some of the subtle but long-term things that we're going to need to really pay some attention to, because not being able to say goodbye to your mother or your father or your grandfather, that's difficult. And people, even if they go through the rituals of, let's say, burial and so forth, they're not able to attend. I facilitated a memorial service a couple of weeks back. It was all by Zoom.
Yeah, so that's a serious point you bring. I think closure is very important for people, who lost their loved ones, and grieving. And you never, full if you lose your parent or anything, but at least if you follow through and you have friends and family at the memorial, you feel you did something. You had a celebration of life, and you feel that you honored your mom or your dad or whosoever you lost. And as you said, with these times, there's I'm a medical director in a nursing home, and I see patients' family crying, through the windows, and they can't get in. It's just so sad. And then you look at the long-term care residents, who depend on their wives or their husbands to come in every day and provide them with moral support, physical support. They can't do it anymore, and it's taking a huge toll on the, not just the residents, which is, as you rightly pointed out, but the families as well. That they feel guilty that they're not there when their loved ones need them. And same thing in the ICUs. I go to ICUs, and sicker patients, their family can't come, and they need them, and it's a very, very traumatic time on both sides. If you're a patient, that's traumatic. If you're a loved one whose patient is in the hospital or long-term care facilities or even assisted living facilities, I was just talking to a patient today, from one of the assisted living facilities, and she was saying that they have not seen their, sons and daughters and their grandkids for months and months, and that's hard.
Yes, and just to expound upon that, and you were mentioning, you've been in nursing homes, you've been speaking to people who are in ALFs, you've been to ICUs yourself. Healthcare providers do their best to step in and fill the gap. We understand the nature of technical care. We understand the nature of the skills that one needs in order to provide care in a hospital, in an ICU, in a CCU, list goes on and on. But now, without the families being able to be present, there are a lot of healthcare providers who are sort of kind of stepping into that. And that's heavy. We expect in healthcare to say hello and goodbye again and again to our patients. In my doctor-patient relationship course, I started with all of your patients will die. I'm not here to bum you out, but they will, either before you or after you, or you may not ever know that. So you will say hello to a lot of people. You will say goodbye to a lot of people, and so now they're coming home, not wanting to get their family sick. A lot of people working a lot of overtime, and they're having to process all of this as well. So again, and speaking with colleagues of mine, particularly those in the Northeast, I have friends who work at Sloan and a few other places, and for a long time, their entire hospitals were like MASH units. They were not prepared for that, and the exhaustion, both physically and mentally. We as healthcare professionals, and perhaps as a broader society, really need to come up with a plan to provide care to them. Just because there's and all of us have gotten into this where you're talking to somebody who maybe isn't familiar with healthcare, and they say, "Well, you signed up for this," and it's like, "Well, yeah, maybe, but not quite." And not everybody is a critical care person. They've been asked to be critical care people. Not everybody is a trauma or emergency room person. They've been asked to step up and do these things. This combination of infectious disease and critical care is a very, very strange place to be. And
I think you bring a very good point. If it is just, let's say, 1 day, 1 week, 1 month, the healthcare workers know that, they signed up for this, but there's no end. Even if we get a vaccine, we don't know how effective the vaccine going to be, whether it's going to reduce the herd immunity, improve the herd immunity or not. And then, if it's going to last years after years, it's hopefully not, but it's what's the recourse for the healthcare workers? It's a very difficult thing. I have a friend in New York, because I was trained in New York too. So I was talking to them, and in fact, Florida. You look at South Florida; it's not very different than New York. In fact, it's flipped now. And he was saying, and I'm talking 2-3 months back when you were saying they have MASH units and stuff. He was not going home. He had 2 kids, one mother in the house, and he was saying, "I'm going to the hotel." So, he's sacrificing even the little bitty support he had with the family, to take care of them. But that's a tremendous sacrifice he's doing, and it's very hard to do it month after month. Luckily, their curve flattened, and we got the stuff here, but it's just not ending. If you think about it, winter's going to be the way things are, the school opening up, and the winter's coming. It's going to be a very scary situation with the second wave. So I think you're right. The fatigue for the food care workers, the fatigue for the delivery people, the fatigue for the the healthcare workers, the fatigue. The teachers are just getting in now. But unfortunately, they don't have as much PPE as we have now as healthcare workers. But still, the constant anxiety, and they are older, and and the kids, luckily, with this disease are mostly asymptomatic, but the teachers can get it. So it's it's a very difficult thing for mental health challenges. So let's talk about solution. I know everyone knows about the ground reality. Let's give them good take-home points from here, Bob. So let's talk about solution. Healthy ways to cope with stress. So you go first, and then I'll add a few things on my own.
Okay. Well, there are a number of things that I speak to everybody about on a regular basis. And these are not only good during COVID, but they're good habits to have your entire life. We began our discussion talking about the importance of sleep. So in order to manage your stress, your cognition, and maintain your health, people have to take their sleep seriously. You don't have to stay up and play the video game. You don't have to stay up and watch the movie. You can DVR it and watch it the next day. So it's very, very important that people pay attention to their sleep schedule. Secondly, nutrition. You have to fuel your body, but you have to fuel it with good food. Sometimes that's hard to do, particularly if people are suffering economically. But there is assistance out there. In our community, we have, food banks, metropolitan ministries, if those are things that people need to do. But making sure that, number one, you have a sufficient calorie count, and if you can, make that calorie count healthy. Some people utilize substances to deal with their stress. I say time and time again, there's a difference between needing a drink and enjoying a glass of wine with dinner. If you feel that you need a drink or you need something else, then you probably shouldn't be doing it. We've gone past the point of this is enjoyable. Now we're using it as a coping strategy. Movement is paramount. I was speaking to some people yesterday. Two of them used the same exact language, which I hear all the time. They're dealing with depression. A lot of it is reactive or responsive based upon some of the things that we're talking about today. And they use the word that they're stuck. And the opposite of being stuck is moving. So exercise, even very, very gentle exercise, getting outside, walking, getting a little bit of sunlight. Don't lay out there and put yourself at risk for skin cancer, but get out and get a little bit of vitamin D. Most of these things your grandmother could tell you to do, and I'm almost as old as your grandmother, so it's probably not so bad. Keep a schedule. So use your electronic calendar, use your paper calendar, make sure that you have things to look forward to, but keep that schedule. Get up at the same time, do the things you need to do each day. Also, try to connect. It's very, very important. We do have electronic methodologies now that some of us would have resisted or have never used before. All of my university lectures from now until the end of the year are going to be done in a very similar format to what we're using today. My niece, at the very beginning of COVID, had a wedding planned. That all went sideways, and so we adapted. And my father, who's 85 years old, is now a fan of Zoom. He had a flip phone before all of this. Now he went out and got a smartphone, so we can see each other and stay connected and talk in that way. I would say that, quite honestly, we probably have talked more recently than we typically do using, hey, let's go get lunch someplace, because that takes a lot of effort. So there are some things that are coming out of this that we might be able to use to our advantage going into the future.
I think we need to look at the positives, as you said, Bob. The positives of the technologies are there, as you said. I'm more connected with my med school friends now with WhatsApp than I ever was. So yeah, there is positives of everything, and there is opportunity in everything, which is not good overall. So let's get a few comments here, if you don't mind. People have been patiently listening, and I want you to encourage to put your comments to Dr. Bob, and if they are appropriate, I'll bring it up. Let me bring one up from, here we go. Debbie is watching us. She's saying, great information. She lost her husband. We're sorry, Debbie, not too long ago, and she's getting depressed sometime. Anything you want to recommend other than what you just talked to someone who just lost their spouse?
Well, no two people grieve the same way, and that's something we need to know. And there are people who grieve in a very healthy manner. Grieving doesn't necessarily mean you have to be depressed. But what I would say is that, if things become complicated and things get tough because you're dealing with loss and change, there's help out there. In the community, if you're, you can get counseling services at Suncoast Hospice. They have groups and memorial services and so forth as well. I do know that they are doing their groups now. They're doing social distancing in their groups, but they're continuing to do that. If you've had a relationship with a private practitioner in the past, that would be a counselor, therapist, clinical social worker, psychologist, right? Reach out to them. They're always happy to have you come back. They already know who you are. And if not, you can establish a relationship with someone. Call up. There's nothing wrong with doing that. There are a lot of online support groups. You have to find the one that works for you. I'm not going to recommend any right off the bat, but you can usually seek out something that can provide you some support and guidance as you deal with the loss and change. And I always tell people this: for many people, not all people, but if they're looking for a general pattern is you have a loved one, they're not well, you're a caregiver, you spend a lot of time taking care of them, they do die, and they've been to the doctor 5 times a week for the last 3 years, and you haven't had a checkup at all because you haven't had time to do it. So if you've not done this, please seek out an assessment from your primary care professional. Get a good head to toe, get some labs done, make sure that you are healthy as you move into the change and loss that you'll be experiencing. And reach out to family and friends. If people say they want to be there for you, don't make excuses that, they're too busy or they have a life of their own. If people offer help, take their help.
That's great points, Bob. Let me just, before we move to more comments, let me just reiterate for people who joined late. This is Dr. Bob Arnold, and Bob has a fantastic psychology practice, and we'll put a link for his practice here. So if you need help during COVID or non-COVID era, any era, he's been a good resource to our patients over the years, and Bob is sharing great tips. Let me bring some highlights of the tips, people who joined late, which he brought up. And the first tip is take care of your body. And Bob mentioned in that, exercise and sleep well, get outdoor, get some sun. In fact, outdoor activities, even if you have insomnia, irrespective of COVID, you go into camping for a week without your electronic gadgets. Studies have shown you can reset your clock. So, outdoor activities of any kind. And we got a lovely backyard in Tampa Bay with beaches. So there's no reason not to go early morning. As you said, stay away from mid-noon sun, but early morning, go out and get some, see some birds, see some white noise or hear some white noise. It's good for your mind. It's good for your body. And to that point, also, yoga and breathing exercises are very useful too. And we do that in our webcast regularly, and we will do one with you, Bob, today and make you a convert.
I love yoga.
All right. And the second piece in the taking care of your body, Bob mentioned, was very important, is nutrition. I think, body is a temple. If you don't offer good nutrition or good offering, the body's output going to be shitty. So it's very important to offer good things to the body. And I'm a big believer in Mediterranean diet. A lot of good research about Mediterranean diet and effect on, brain health. We did a big talk on dementia, and I think, it kind of overlaps into dopamine, serotonin axis as well. If you eat fast food and processed food, it does make you feel lethargic, if you notice, after having a big burger. So a plant-based diet, more fish, more olive oil, more healthy nuts, will help your mood. More berries, more antioxidant-laden foods are good for your mind. So keep doing that consistently, and sleeping well, and hydration is another important aspect Bob touched on, and I want to reiterate, and Bob brought the bottle with him too. We didn't do a smell test on it yet, though.
It's water.
All right, so hydration is critical, and just understand soda pop, juices, Gatorade is not hydration. Hydration is water only. You can flavor the water, add some lime or lemon or orange slice to that, add some ice cubes to it, but try staying away from Coke and anything beverages which are carbonated and is processed, because they just increase your body girth and without giving you satiety, and makes you more tired and dehydrated. The other thing Bob pointed out is to make time to unwind, and try to do activities you enjoy, whether it's physical activities we talked about, could be biking. And I want to make this point very clear. A lot of people ask me day in day out, exercise outside, walking outside, outdoor activities of any kind is safe. We need to learn to live in the new normal. The new normal with COVID-19 is we got to take care of our health long term. We don't want to not get COVID by staying indoors, but then get heart attacks and strokes. How good is that? The other diseases, diabetes does not wait. If you not going outside, going to die from other diseases. So it's very important to know that COVID-19 is not the only disease which is going to kill you. It is an important factor, but you got to take care of your other well-being, whether you are getting counseling, let's say for schizoaffective mood disorder, or anything could be. Don't stop that just because you're afraid to see your counselor or mental health professionals. Is in fact more important with the social isolation to continue with the treatment. And unwinding we talked about earlier, it's very important to do that consistently and make effort, and as Bob said, put it on your calendar to unwind. The other thing Bob mentioned, which is fantastic, is connect with others. Talk with people you trust about your concerns and how you feel. And I think, like Bob was saying about his dad, and I was saying about my friends and colleagues from my med school, any network is good, whether it's family connection, whether it's a professional connection, whether just the friends in general. Any connection where you feel good with, and reaching out more, than what you normally do. And technology, as Bob was pointing out, is a fantastic boom. And even the older folks are seeing the value in throwing their flip phones away and getting the smartphone, as Bob's dad did. And once they use it, like my mom does WhatsApp all the time and I remember it was so hard for her to change a few years back, and now she's a queen of WhatsApp. So it's just a matter of getting comfort and just do it a few times, and it's very intuitive. Those new devices are fantastic. They just they will walk you through. If you have a younger grandkids or a younger son or daughter, they would love to show you that, because that's what they do day in, day out. And the last, not the least point Bob brought up, I think is important, is if you are a faith-based person or have interest in community with different connections, or you were going to AA or any other organization, they all moved to Zoom. You can do church-based activities on Zoom. You can do, everything has moved online. So, in fact, I was talking to one of my guests, Bob. His wife has dementia, unfortunately, so he's a caregiver. And he was telling me that the Birds Institute has a support group on Zoom. So, everything has moved online. It's just get comfortable with the technology. I know older folks have that phobia, but more you're going to use it, more you'll see, gee, man, there was nothing to it. You've done more complicated things in life, like raising children. This is this is. Did I miss any point, Bob? You reiterated.
No, nothing that you have. But there is one thing I would like to add, and it actually aligns with this. So technology has provided us with amazing ways to connect with one another, but it has also tethered us to a 24-hour news cycle, and all of the noise that comes along with it. So when we talk about kind of scheduling out our days, it's very, very important that we break away from our screens, whether it's our phones, our tablets, our televisions. They've become part of us in some cases. And just as an example, and we're not doing it live, but when we were doing my doctor-patient relationship seminar live, I would tell all of my students to put all their electronics in their car they're not going to need them. And the first 2 weeks, they would actually have the shakes. They're like, because they're always checking their phones or looking at their screens. And then by the third week, they said, "Oh my gosh, this is amazing." When you were discussing go camping or get out, reset your clock, that takes intention these days. And so although technology can be a real boon to what we're doing, it can also work against us. So limit, your news consumption to maybe an hour a day. Once you've gone past that news hour, there's not really any more news to hear. And there's a lot of negativity. Most news programs by design have about 40 minutes of the world's going to end and about 5 minutes of real sweetness at the end, so you come back the next day. It's too much. It's too overwhelming. And I do know people who sit on their recliners all day watching people yell at each other, telling us that the world is going to end. And that's not helpful if you're trying to live a healthy life. So turn it off.
Let me bring a comment on the same line. I think, that's, unfortunate. So we have Terry watching it. He is losing vision in his left eye and is depressed from that. I think that's again, it's not COVID related, but, things happen in life, and, losing one of your senses is a dramatic change you have to get adjusted to. And do you have any, just off the top of your head, a few ideas you can give Terry? I know, again, it's not a doctor-patient relationship, just general, if someone losing a limb, amputation, so.
Well, something that we don't typically talk, there's a lot of talk about people who deal with depression, but depression secondary to a general medical condition is rampant. The overlaps and the correlation between the two are kind of indecipherable. So if somebody is dealing with pain, loss of sensory, loss of mobility, right? And I'm using the term loss quite a bit because this is what happens sometimes with dis-ease, okay? There are some things that we can recover from. There are some things that are chronic, debilitating, and degenerative. First and foremost, as part of that plan of care, when someone is first diagnosed, this is really where, specialists, primary care physicians, and people such as myself should really be sort of leaning into one another to create a comprehensive plan of care. I would definitely encourage somebody who's dealing with this to work perhaps through their specialists and find a counselor or a therapist to assist them in the shifts and the changes. There are going to be emotional, cognitive things that happen. There are going to be very, very functional things that occur too. And all of those things need to be addressed because a lot of adaptation and change will occur with the loss of eyesight, the loss of hearing, and so on and so forth. So this really becomes, a more multidisciplinary kind of issue. And I would say to any individual who has experienced things like this is, you have to create a team or have somebody create a team for you to be able to support you through those changes and a new way of living. And
I think that's a great point. A lot of time we think we are weak, we can't do it ourselves. And with such a profound loss, you need help. And there's not a sense of weakness. It's all of us go through ups and downs in life. And if you're down, get someone's hand, and it could be a professional hand with counseling, or mental health professional, or social worker who specialize in mental health. Any of those or all of those, and your primary care physician, your psychiatrist, if you need, to go there if the primary care is not comfortable. So yes, it should be multidisciplinary approach in someone as profound. Let's get another comment. I think, Patty brings a good point. She's talking about alternative medicine. She's talking about green tea, magnesium, meditation, breathing technique. So what's your take on all of that or any of that?
I think all of those things are absolutely magnificent. The idea of being able to explore ways to keep oneself healthy and well is very, very important. in most things that I do, I take a relatively conservative approach, right? So with the ability now to really do better research and understanding the cause of effects of things that are a little bit more naturally based, just can really make our life easier. There was a time when all we had were the big guns, right? Very powerful pharmaceuticals that had a lot of side effects. Sometimes they're necessary, sometimes they really work, sometimes they're the only thing that does help. But taking a cautious, thoughtful approach, like you're taking the latter, right? So, magnesium has been found, people, it helps them sleep. Why wouldn't you do a little bit of that, as opposed to maybe the next level would actually be something like a melatonin, and the next level would be something like a Benadryl, right? The anti-inflammatory effects of CDB are being studied quite a bit now across the board. So people with, autoimmune disease, people with anxieties, people with other types of pain, which can keep them from getting a good night's rest, feeling good, get the mobility. They're finding that is really being helpful. The only question that I have is, people need to make sure that if they're exploring these things, that they're doing it under the supervision, even though they're natural substances, that you're talking to your doctor about it. I've seen people end up in the hospital because they took too much vitamin D. And if you are taking other medications which are prescribed, we need to make sure that there aren't any interaction effects. So
that's a great point. People don't realize, and I'm glad you brought it up, Bob, that over the counter does not mean the body thinks over the counter is safe. The body doesn't care a shit about it's over the counter or Dr. Mahajan wrote the prescription.
Yeah.
The body says, okay, I got a chemical, and there are other chemicals floating, and you got to be careful with chemical to chemical interaction. So, the pharmacists are a very good resource. We underutilize the pharmacy education. I think pharmacy are so super well trained in looking at, and they got access to a lot of drug interaction softwares between OTC stuff and prescription stuff. So use your pharmacy as a good resource in addition to your physicians' offices, and don't take anything just because it's over the counter or Aunt Susie loves it. She got better overnight by taking it, and she sent you a sample. It's good that you want to explore, as Bob said, but you want to be careful. Anything you put in your mouth, as I alluded to earlier, body's a temple, whether it's over the counter, prescription, medication, or foods, everything goes in the body and the body has to react. And you want to make sure the other things which you are taking, it's not reacting in a harmful way. So yes, that's a great point you brought, Bob. Let's bring one more comment and then we'll have you have the final say on if you didn't add anything. So let's see. We got Loretta. Thank you, Loretta, for watching. We need zinc. I'm not sure about that. Let's just not get very specific on the micronutrients. They are have value, but they are micronutrients. You don't want to make it a macronutrient. So yes, whatever is in the foods, the body can digest it better. But if you start extracting and wherever the human end goes, the composition change. And I'm not a big fan of human hand. So if you can find foods with zinc and antioxidants, go for it. A lot of ophthalmologists use cocktails, with which are safer, just for the eye point of view. You can use those. Let's see. Heather said such a good idea nowadays. Yes, Bob brought a lot of great ideas. Thank you, Bob. Let's see. Oh, Stephanie lost a house through fire. Sorry, Stephanie, for your loss. Hopefully, you have insurance. What you're going to do. This is unfortunately, good days will come, and we got to just be praying for you, and God willing, you can of course replace the house, but not the memories what you have, and the pictures and all that get lost, and that's a serious grieving. Did you have anything to add to that, Bob?
Well, my hope is that if somebody loses their home, they've been put in touch with the right agencies to help them. I can say that the Red Cross does the best that it can to assist people under these circumstances. My hope is that they were able to interact with the Red Cross, and they can begin to get people at least back on the path of being able to have a safe place to stay until other more permanent arrangements can be made. But losses like that are terrible. And you mentioned the memories, and I think that sometimes we forget that. People make memories in their homes. They sometimes have objects that do have special meaning that aren't retrievable. We always pray that there's not a loss of life, human or pet, otherwise. And that's your first good news, right? But the next is having to start over again, and this is a tough time.
All right, Bob, we're coming to the end of our program. I still have to do a drawing for our previous podcast or webcast, people who put comments. So I'll give you, another few minutes to wrap up. And if you want to highlight a few points or you didn't bring any points up yet, I'll leave the stage to you.
Okay. Well, we were talking about, we went a little bit over here and over there, but, the main focus of our discussion today was about how COVID may have impacted mental health, particularly issues with anxiety and depression. It's important that everybody knows that there's help in the area. If you are stuck and don't know where to go, call 211. Okay, our helpline in the area is very, very good at connecting people with resources and services. If you have a primary care provider, visit with them. Please always be honest. When people ask you how you're doing, we're apt to say, "Oh, I'm doing just fine. Everything's good." And in fact, it might not be. I talked about people suffering in silence, and that isn't something that they should do. For people who are uninsured or underinsured, we have community mental health centers in Pinellas County that do an absolutely marvelous job of being able to provide high quality services. For those folks who are working and those people who have insurance, every insurance policy, every company for the most part has either an employee assistance program, and your insurer will have a list, usually on their website, of providers in your area. So you could just type in what you're looking for and type in your zip code, and a list will come up of people that you can contact to try to make an appointment with. For those of you who are a little concerned about making visits to people, particularly counselors, because of COVID, almost everybody that I know is using some platform in order to provide telehealth services regarding counseling and psychotherapy. And so, if you do not wish to get out of the home, or if you happen to be fragile and can't do that, there are a host of folks who are doing what we're doing right now, right, but in a very personal way, in a very confidential way, in a very secure way, to be able to talk through things, problem solve, find some encouragement, and maybe get onto the path of healing. We are very fortunate. There are a lot of things that maybe don't go as smoothly as possible, but Pinellas County is very, very, very deep in healthcare services. We have amazing community resources, and reaching out to them is just a phone call away. So again, if you don't have a relationship with a practitioner and you don't have the access to healthcare, as many people may not, you can call some of the community-based service centers, and they will make sure that you get what you need. Probably the most important thing I'd like to end with is that this is a tough time for everybody. Just be kind. If you show kindness to one another, everything's going to probably work out. We don't need to have, mass rage in a Walmart. We don't need to jump up and down and yell at folks. Help somebody out, and you'll feel better, and they'll feel better. So,
I think you're stealing my lines, Bob. I end my webcast by saying being kind. So that's fantastic that you have similar thoughts. I think absolutely what you shared is beautiful in terms of if if you give to someone, I think you get much more back. So that's your point right there, and it helps you with the healing. So with that, we want to thank you for coming. It was such a wonderful joy to have you in our webcast, and you brought such beautiful points. We're going to leave some community resources and national phone numbers, hotlines, on our comment section too. So for anyone who wants to use it, those are free. So you should not feel alone. And as Bob pointed out, those resources which are community based locally, and you can use them as well. With that, we want to thank Bob for coming, and stay safe, and say my hi to your lovely wife, Michelle.
I will.
Yeah. Bye bye.
Bye-bye.
All right. So with that, let's get to the drawing, and I appreciate. Let's thank all the folks who joined, our show today, and then we'll go to the drawing. Stephanie is watching. Thank you, Stephanie. And then we got Mr. Naresh Gupta is watching. Thank you, Mr. Gupta. Ray Davis and Caroline is watching. Thank you both. Terry and Loretta are watching, and they were the lucky winner of the last week draw, and we just had a chance to shake hands with them. Sandy is watching. Thank you, Sandy. Deborah Hawkins is watching. Thank you, Deborah. Patty Clark is a good contributor to our webcast. Thank you, Patty. You had great ideas today about alternative ways to cope with the mental health. So thank you for those great ideas. Heather Sutton is watching. Stephanie Conrad is watching. And Michelle Arnold is watching. All right, Michelle. Denise Andrea saying, hi, Dr. Mahajan. Hi, Denise. Thank you for watching. Linda Canali saying, hi there. Hi, Linda. Julie Krause is watching. She got a thumbs up sign. So all of you guys are put in our draw for the next webcast next Thursday at 4:30. And it's on similar lines. We have an amazing guest next week. And I won't give you her age because that's going to be a top secret. And you will see why I'm saying that. And she's going to share how she got, where she got, and why she got, and how healthy she is mentally, physically, emotionally, spiritually, all aspects. And every time I see her, I say I need to sit down with her. And finally, she agreed. She's a very shy person. So you're going to see the treat, what I'm going to bring you next time with our next guest. So do tune in on our webcast on next Thursday at 4:30. And let's do a quick drawing on our previous people who commented on the previous webcast. So here we go. So let's see, what's up for grab is the $25 gift card from Publix. So here we go. Let's take it out. That's up for grab. And let's take up one slip, and let's see who's the lucky winner. Here we are. So the lucky winner is, oh my God, she's already on our webcast today, Deborah Hawkins Huffman. All right, Debbie, you comment regularly, and you got the $25 gift card. So congratulations. I'm very happy for you. Let's talk about the last piece, which is the breathing piece. And we got you the alternate nostril breathing. And some of you guys have done with me in my previous webcast. Is one of my favorite in terms of helping with the anxiety and mood health. It gets you calmer. So it's very simple and it's very effective. So let's do it a few times with me. So you sit up straight with your spine straight, and then put your hands on your knees, the left hand on your left knee, and then bring up your right hand and breathe out and close your right nostril. Now breathe in through your left nostril, and then close your left nostril with your ring finger, and then breathe out through your right nostril. Then breathe in through your right nostril, close your right nostril, and breathe out through your left nostril. Breathe in through your left nostril. Close it gently with your ring finger, and then breathe out through your right nostril. Breathe in through your right nostril and close your right nostril gently with your thumb, and then breathe out through your left nostril. That's it. It's also called Nadi Shodhana. In pranayam circles or yoga circles, you can do 5 cycles of that 2-3 times a day. Anytime you're anxious, just go in a quiet place and do that, and do it for 5 cycles, 10 cycles, and keep your eyes closed, and think of the happy energy coming in and the negative energy going out. It's not going to cure your problem, but it will improve your coping skills, and your parasympathetic system will calm your brain, so you will have better reactions. That's what you can control, is your own body, your own reaction. You can't control your spouse reaction, you can't control your kids, your friends, your family, but you can fine tune yourself to how you react. So, and then meditation, breathing techniques, they're useful in getting you those skills. And we're coming to the end of our webcast, and I want to thank you for joining us today, and I want to thank Dr. Bob Arnold for coming in. We'll leave a link for his practice if you want to find a good mental health professional. That's a good person to contact. With that, be kind to yourself, be kind to your family, your fellow human being, be kind to Mother Nature. And we'll see you next Thursday, same time, 4:30, and we'll bring another exciting guest, and she's going to talk about how to age gracefully, both in all aspects of your life. Looking forward for you guys tuning in. And congratulations to Deborah Hawkins Huffman for winning a $25 gift card for this raffle this time. And keep your comments coming. And even if you're watching not live and later, if your comments if you put comments, you will be counted towards our raffle for next time. Thank you and namaste.